on the front lines will change your mind. And if you think you can break social isolation just as long as nobody sees you, well, sorry, dude. Your phone sees everything you do. In Oregon, we need to do better. And if our leaders are having trouble getting people to socially isolate, how about a page from leaders across the pond? Here's the story. I am Dan Haggerty. Welcome to The Story, where we remind you that being socially distant doesn't mean that you have to socially isolate. Don't worry, I am here for you. I know, you never thought that that would sound comforting, yet here we are. Things have officially gotten pretty weird. I mean, look at how we had to have our morning editorial meeting today. It's like a really boring version of the Brady Bunch. And I know I look more like a Mike, but I've always felt more like an Alice as we try to guide you through this situation and uncover everything we can. To quote Cindy Brady, "I'm not a snitch, I just tell it like it is." Yes, that is a real quote. So tell us what you want to know. Give us your questions. We will quote you here on The Story. Email us. Send me a message on Facebook or Instagram. Use Twitter. Use the hashtag HeyDan. Now, here's the story. And we are going to start tonight with our big story and a nurse who wants you to know what her job is really like right now battling this pandemic without enough PPE. Now, you've probably heard that acronym a lot lately. PPE stands for personal protective equipment. That means the masks and the gloves and the other gear that healthcare workers use to treat patients without getting sick themselves. There's a national shortage, and because of that, doctors and nurses are reusing this stuff over and over when normally it's only supposed to be used once. In fact, last week, the CDC put out guidelines saying if you're completely out of masks, then wrap a bandana around your face. And last night, the union representing nurses in Oregon said that they're expecting some facilities to run out today. So what's it like trying to treat people amid all of this? Maggie Vespa joining us now. Maggie, you talked to a nurse who agreed to do this interview with us knowing she was breaking the rules.
Yeah, Dan, exactly. She said she's been told not to talk to the media, and she's really afraid of being reprimanded for kind of pulling back the curtain on this. So that in mind, we do want to point out we have vetted her. We've confirmed that she is a registered nurse in the state of Oregon, but we will not be telling you her name or showing you her face. All that said, here's her story. I'm recording now. Is that cool?
The conversation was via phone with a nurse of more than 30 years who works at a hospital on Oregon's coast. She was nervous.
Your name will not be broadcast, will not be printed.
KGW is letting her speak with anonymity after verifying her nursing license through the state's registry. We were connected to her by the Oregon Nurses Association, the union that represents 15,000 nurses and healthcare workers statewide. This nurse told me she has never felt more vulnerable.
I mean, when you say that, can you elaborate?
She said last week she was issued an N95 mask, quote, in a Rubbermaid container, like what you would put your lunch in. Normally something used once and disposed of. She said she was told to use it up to 5 times going between rooms and patients. She said that's what makes you feel vulnerable because you can't see a virus, and I don't want to give it to somebody. Something else that scares her? She said nurses and doctors are treating patients for things other than COVID-19 with no gloves and no masks, no protective gear at all. That's normal during normal times, she said, but during a pandemic where experts say this virus can go undetected for weeks, she feels unsafe, telling me, you can't listen to somebody's lungs and socially distance yourself. You can't help them to the bathroom and socially distance yourself. And I'm without any protection. She added that's the case going into and out of the hospital. KGW has confirmed with major hospital groups, including OHSU and Providence, that unless they performed surgery, doctors and nurses are still being instructed to take their used scrubs home and wash them in their personal laundry machines. Research shows detergent is indeed effective at killing the virus, but this nurse is worried about bringing those scrubs out of the hospital at all, let alone home. Quote, I don't want to bring it home to my husband, she said. I don't want to take it out in the community. Heaven forbid. For now, she knows the PPE shortage is a national problem. And she said a supervisor mentioned last week another shipment of gear might be coming soon. This nurse has no idea if that's still happening or how much PPE she should expect if it does. So she's keeping that mask in its Rubbermaid container.
Wow. Okay. So, Maggie, that was everything that I guess I thought it would be, or I was afraid that it would be.
Yeah. Yeah, 100%. You know, we're going to get into sort of one of the last issues that she presented toward the end of that piece, which is why we're hearing so many healthcare workers don't know how much PPE to expect and when to expect it. We'll get into that here in a minute. But first, I want to show you some good news because I think we could all use some by this point. It comes from Oregon Governor Kate Brown. She said this during her sort of conference call with the media this morning.
Yesterday, we received a truck delivery of equipment from the national stockpile, and we expect to receive another today. We are still taking inventory, but we believe this should amount to about 25% of our requested PPE from the national stockpile. Yesterday's shipment included 87,000 procedural masks, nearly 9,000 gowns, and 14,000 gloves.
All right, so there you go. A lot of people wanting to hear that. Oregon has gotten more PPE supplies, and we expect those to be doled out to counties and hospitals soon.
But again, just 25%, you know, not the whole order. That's not exactly what people want to hear right now.
Yeah, and that's kind of the point that I was alluding to earlier. That mirrors what we're hearing from the state level. And officials told us today the Oregon Health Authority is getting these requests from hospitals via their county health departments, and that's normal. But the requests are getting so much bigger and they're coming in so much faster that the state has only been able to send counties partial shipments of what they ordered. And that's been kind of getting to be the case more and more for weeks now. So hospitals aren't getting all of what they ordered. And that explains why even a hospital on the coast, which hasn't really been hit by COVID-19 like the Portland metro area, other big cities have, even they're running low. And that's because the state will send less to the coast to try and send more to those metro area hospitals. They're really trying to balance all of this. So Dan, it's confusing and it's kind of, you know, leaving people like that nurse that we talked to in the dark right now.
Do we know how low they are? We keep saying that they're low, that they need more. Do we know how short these hospitals are?
Long story short, no. We've been trying to get those answers, but with so many different entities, you know, private hospitals, multiple sort of levels of government, local and state involved in this, we've had a hard time getting hard numbers, and hospitals are kind of judging their need themselves. So there's no sort of one uniform level that we've been able to find at this point. We'll let you know if that changes. That said, I got a quote from a Multnomah County spokesperson a minute ago. She said, quote, "We expect to receive thousands of masks and other requested items from the state starting today." Again, expecting thousands, but she said, we need hundreds of thousands. So that's jarring to hear.
All right, Maggie Vespa with the latest. Thank you so much. If you at home have questions for Maggie, reach out to us here at The Story. Use the hashtag #HeyDan. Again, thanks to Maggie. And a lot of people have already been emailing asking ways that they can help. Lisa Lake sent this one in recently. I've heard that some hospitals are asking the public to make cotton masks. And Jeannie Schultz, she wrote in and said, "My grandson is making 1,000 masks for the healthcare workers for his senior project, cutting materials, sewing, etc. I will say you're helping to raise a good kid." That sounds like a good move. Thanks to both of you for writing in. But here is the deal as we know it right now. We've been asking around. There's no one answer on whether local hospitals will take homemade masks. Now, Providence told us they would. The nurses union that Maggie mentioned a moment ago said that they might soon. The Oregon Health Authority basically said not yet, but they were a little vague on exactly what that means. Then finally, the Multnomah County Health Department was kind of straight up with this, and they said a spokesperson quoted this: "We have a whole donation arm working with community creators, but we're awaiting federal direction on a uniform pattern, supposedly out tomorrow." So bless you, Multnomah County, for that help. We'll, of course, keep a lookout for that for you so we can let you know what that means and what those guidelines are as soon as they come down. Now, I think something that we have learned from the last couple of days is no matter how clear our leaders think that they are being, it's almost never clear enough. Take yesterday's double executive orders. Governor Brown and Inslee, they both signed mandatory stay-at-home orders, shutting down all businesses where physical contact is unavoidable.
I have been very, very clear in my executive order. If you can't maintain 6 feet of social distancing, if you can't teleconference, if you cannot provide your customers with a takeout option, you must shut down.
Governor Brown's 8-page order listed some of the businesses that have to shut down, like spas and hookah bars. It also listed barbershops. I did want to warn you at home that certain on-air news personalities may start to look a little different without our typical grooming habits, though we will finally get to see what Mike Benner looks like with his hair grown out. But all in all, Oregon's order was pretty simple. Governor Inslee's, on the other hand, he spent 14 pages alone on companies that were exempt from his order. An exhaustive list. And we've heard from some Oregon workers, such as taxi drivers, who wished Governor Brown spelled out her order in the same way.
It's specifically mentioned every black and white radio cab just gets to pass because it's specific. Everybody knows. So in that regard, yeah, I absolutely would like it to be spelled out.
But again, Governor Brown explained she would rather create criteria for staying open rather than list everyone. So if companies can have people work from home or practice safe social distancing, then they can stay open. Personally, I think if our leaders need some help clarifying their message, they might want to consider taking some lessons from the governors and mayors across Italy.
We have agreed on a plan called Stay Home, Stay Healthy, which is both an order and a public awareness campaign.
Mi arrivano notizie che qualcuno vorrebbe preparare la festa di laurea. Mandiamo I carabinieri, ma li mandiamo con I lanciafiamme.
This will be a stay at home unless it's absolutely necessary order.
Siccome io sono il sindaco di questa città, in questa città il decreto lo faccio rispettare io. Quindi se ne deve andare a casa adesso, non voglio le scuse. Tutti, dovete stare tutti a casa.
We expect everyone in our state to comply with these orders voluntarily.
Che domani vi becco, domani, non pensiate tra anni, domani. Sono il sindaco, sul mio territorio non si passeggia. Non vi posso impedire formalmente di uscire da casa? Bene, vi impedisco di passare sul suolo pubblico.
So I guess the takeaway should be follow the stay-at-home orders. Don't get to the point where our mayors and governors are yelling at us, though I'll admit I think it might be more effective.
All right, so you have 3 extra months to file your federal taxes. But what about your state tax? And what about that art tax that everyone already complains about? Now, the safest place to be right now is inside your home. But what if you share that safe place with an abuser? There is help. And if staying inside were a contest, Oregon would be losing when the story continues.
We've been getting so many questions about the stay-at-home order. So Valerie wants to know, I'm curious whether having family members who live outside the home are permitted to visit elderly parents during the shelter-at-home order. Okay, listen, the entire point of the stay-at-home order is to stay at home. So doctors are saying you really should not be around elderly residents right now. That being said, the order does not specifically stop you from going to a family member's home. Now, when it comes to assisted living facilities, Oregon DHS limited all visits to those facilities to just essential medical personnel and emergency personnel. You can only visit residents there who are in end-of-life care. Another question is from Jeff S. He asks, I work at a construction company. Is my industry considered an essential business and exempt from certain stay-at-home order provisions? All right, so according to the governor, if you cannot work 6 feet apart and maintain social distancing and you cannot telework, then you shouldn't be working. That business should close. That's according to the governor's executive order. Governor Brown says they may come out with specifics on what jobs are essential versus non-essential if they hear people are not complying. Please keep sending in your questions. We will do our best to answer them using the hashtag HeyDan. Hey everyone, it's me again, not trying to take over the show. We're just trying to answer as many questions as possible. So this viewer wants to know, hey Dan, is the state going to extend state taxes date filing like the feds? Okay, so according to the Oregon Department of Revenue right now, you still have to file an extension, but you will automatically be granted one. Based on the governor's comments today when she was asked about it, that may soon be changing. So you can either wait or just go ahead and file that extension. Keep sending those questions in. We are doing our absolute best to answer them.
Kristen, thank you. Again, keep those questions coming. Use that hashtag #HeyDan. You can also email the story at kgw.com. You can shout it from the rooftops if you want, but you might have to live in Lake Oswego or I'm not going to hear it. You get the point, right? We want to answer all of your questions. And Kristen is going to be getting to some more of them. If we're not getting to them here in the story, we answer a lot of them during the 7 o'clock news hour. Kristen's been anchoring that, so check that out. Now, one of the questions we've been getting a lot is one that Karen Miller asked us, and this is also tax related. She said, "Hey, Dan, is the city of Portland changing the due date for the arts tax from April 15th to July 15th to align with the IRS tax filing change?" That's a great question, Karen. Thank you so much for asking it. First, just so we're all on the same page here, yes, the Treasury Department has delayed both your payment and filing deadline from April 15th to July 15th. So you get 3 extra months now. And tomorrow is the deadline for Governor Brown to make a decision about whether she's going to delay state taxes. We asked the city of Portland also about the art tax, and we found out that they are also waiting now for the state government to make the decision. A spokesperson for the mayor said if the Department of Revenue extends the filing and payment deadline for Oregon personal income taxes, the Revenue Division will extend that relief to the arts tax. So unfortunately, we just don't quite know yet what's going to happen with the art tax, if it's going to be delayed or not, but we should know by tomorrow. Last night on the story, we had a question about crime. Tom asked, "Hey, Dan, with all of the reporting on the pandemic, we're not hearing about local crime like murders. Is the crime rate dropping or just not being reported?" Hey, keep those questions coming. Use the hashtag #HeyDan. We can tell you the Multnomah County Sheriff's Office told us that their calls were way down and they were booking fewer people into jail. We also got some numbers back from Portland Police, but they were much less about crime and more about people who need help. So overall calls are down about 10% for Portland Police compared to early March. But here's what we kind of found to be specifically troubling here. Suicide calls to 911 are up 23% from earlier this month. They're up 41% from last year. There are also a lot of people calling police to ask for emergency food boxes right now. So listen, you keep hearing it from us over and over again that we're in this together. I almost start to feel a little corny. I've been saying it so often. But this is what I'm talking about. People are isolated, they're scared, they're out of work. They may feel more alone right now than they ever have before. So maybe instead of flipping through Netflix tonight, you can take out your phone, flip through your contacts, call or text a friend who you haven't talked to in a while. Check in on them. Remind them that we are, in fact, in this together. And remember, if you or someone you know is going through a crisis, call the National Suicide Prevention Hotline, 1-800-273-8255. You can talk to someone 24 hours a day. Now, we also asked Portland Police about domestic violence calls. Now, they didn't have any stats for us right now, but you may have seen some of these headlines we're putting on the screen saying that for people who live with an abuser, staying home is not always safe. And now that people are under an order to stay home, those people might not feel like they have anywhere to go. One of the stories that we want to highlight here is from the New York Times. It says an uptick in domestic violence has already been recorded in China. The hashtag anti-domestic violence during epidemic has also been trending on Chinese social media since the outbreak started. So is something like that also happening here at home? Well, we reached out to Raphael House, a domestic violence shelter in Portland. They told us our 24-hour hotline has been receiving more calls than usual, and we anticipate that will only continue to increase as domestic violence abusers take advantage of this crisis by using power, violence, and threats to control their partners. They're also seeing more survivors who are reaching out in need of things like food, since a lot of people have lost their jobs. So, what can victims do during this time? Well, experts say people living with an abuser should find the safest part of their home. Also, shelters are allowed to stay open right now, but some have decided to close to stop the spread of this virus. In that case, victims can still call for help. The National Domestic Violence Hotline is 1-800-799-7233. And in an emergency, you should always call 911. If you don't feel safe calling for help, the experts recommend that you ask a friend or a family member whom you trust. Now, here's something that we really think is worth your time. It might even be a wake-up call, so to speak, a very creepy wake-up call, if you ask me. A website called Unicast, or Unicast. They're using this data from the GPS in our smartphones to track whether we are being socially distant or not. Yes, they can do that. In Oregon, I've got some bad news for you. We're not doing a very great job at staying at home, even though it's one of the easiest ways to prevent the spread of COVID-19. In fact, Unicast says that out of the 50 states that they monitored, our whole country here, we're in 46th place behind New Mexico, Idaho, Montana, and Wyoming. Unicast breaks it all down by county, too. Jefferson, Umatilla, Morrow, Harney, Baker counties, they're all scoring low markings right now for staying inside, while Gillum and Sherman are scoring perfect A's, followed by Multnomah, Washington, and Clackamas counties. You can look at each state individually if you'd like. Washington is doing pretty good. Just go to unicast.com/COVID-19. We think it's really worth your time, and we'll get into the obvious invasion of privacy, I guess, a little later.
Hey everybody, I'm Matt Safino. I came across this over the weekend. It was put out by the Portland State University Climate Science Lab. Now remember how we heard about all the pollution going down in China because of the virus, and then in Italy pollution went down? Not in Portland. This was on Sunday, that last really nice day we had, and this graphic is showing us the particulate matter, the really small stuff put out by wood burning, by wood smoke, and all those yellow colors and orange colors.
Wow, that was starting to get really interesting. We lost Matt's mic. As you could tell, he was reporting or doing his weather from home. So that's kind of what we've been doing now. I'm actually the only guy in the studio. There were only like 10 people in the whole newsroom during the day. We don't get close to each other at all. But we're going to check back with Matt. As you can see, he was showing a little map there that shows that even though Portlanders are staying at home, we're using our wood-burning fireplaces, which puts a lot of particulate matter up into the sky, and our pollution has not gone down, thus maybe something we should probably think about. Now, we want to change gears here to a little segment called In Other News. I think it's a good break from all the coronavirus coverage and a chance for us to look at some of the stories that aren't really getting much attention right now.
In other news, the Salem City Council just passed its sit-lie ban. That bans homeless people from sitting or lying on the sidewalk during the day. The Statesman Journal reports that the city must provide bathrooms and a day shelter before police can start enforcing the ban. Salem has also scrapped its plan to put a huge tarp over a park as a shelter for the homeless. Gresham police say a woman stole a car at gunpoint, then almost hit 3 people while being chased by police. Police say Adriana Talamance asked a man for a ride Friday morning near Kane and Division. They say she pulled out a gun, ordered him out of the car, and took off. Police caught up with her, but they say she drove through 2 yards and on a pedestrian path to get away. 3 people had to jump out of the way of the vehicle. She was arrested after crashing into a retaining wall. The University of Portland is planning to keep Terry Porter as its men's basketball head coach. The Oregonian reports that the former Trailblazers star has 1 year left on his coaching contract. He has a losing record with the team of 37-92 in 4 seasons and has only won a single West Coast Conference game. And that's In Other News.
Okay, this viewer wants to know, hey Dan, how did China seem to get COVID-19 under control, managed within a few months, while other nations like ours seem to be taking or predicting longer? Thank you, Chris, for that question. Okay, according to research and the New York Times, they got it under control by using aggressive quarantine measures, so public transportation shut down. Private cars were banned from roads. Residents were banned from leaving their home. No air travel. Police enforced stay-at-home orders, and people who showed symptoms were immediately isolated and not allowed to return back to their families. Please keep sending in those questions using the hashtag HeyDan.
All right, thanks to Kristen. She's going to have some more of your questions answered coming up tonight at 7 o'clock. In the meantime, a couple of comments. Amy writing in, hey, Dan, is the state of Oregon extending the date to have your studded tires removed? We can all hear you coming down the street, right? Yes, the answer is yes. It's been extended till May. We answered her directly on Twitter, but I thought I'd say it to all of you since it's a pretty common question. Governor Kate Brown from Garrett saying, was very vocal and visible on Friday. Why hasn't she held a press conference and Q&A after her announcement? Is she hiding from the press and Oregonians or quarantining? Well, I'm sure she is quarantining and abiding by her our own kind of rules. But at the same time, she has been talking to us. She talks to us almost every day. We have a huge conference call. She spends a lot of time. Trust me, the governor's being transparent, answering all of our questions. Hopefully, we're relaying that to you. And then Charlie, lastly, on Facebook saying that we should change something up. We have Throwback Thursday on Instagram. We should have Till We Meet Again Tuesday and post all the pictures of friends and family having a good time, arm in arm, before we were all socially distant from one another. But look, we miss everybody, right? We miss that contact. Hopefully we can find some type of connection here as we share each other's story. For now, that is the story. We'll see you next time.